My name's Chris, and I'm with the British Columbia Lung Association, and I have the pleasure of being seated here with Mr. Barry Jessiman, who is the head of the Air Quality Assessment section of Health Canada. Welcome.
Thanks very much.
So let's start off with giving ourselves the smallest pat on the back here, because the air pollution levels in Canada and the US have decreased significantly over the past few years. Why should we continue paying attention to our air pollution levels? Is there a point where we can stop focusing on air quality, or is that something we should always be on top of?
Well, it does look like the health effects of air pollution are quite substantial even at our reduced levels. So we've been, in the early days of air pollution research, we were looking for some easy to manage large scale sources, and we're pretty successful in reducing those. But as we looked through what we thought were the continuing effects of air pollution, it appeared that what was left in terms of the effects of air pollution that we have, say, of today, exceed what we've reduced over time. So we've been successful. I've been at the WHO meetings quite often, and they're always semi-congratulatory about how low our levels are. But nonetheless, our understanding is that we still face quite a large population health impact of air pollution.
So how do we know that our levels are low enough? I mean, we're obviously doing well, but obviously we can do better. So how do we know those levels are low enough?
I think we'll never know in all essence, but it doesn't appear that really we can go low enough. The effects are, we've been doing a lot of research lately to try and characterize this. It's probably one of the most important questions in air pollution science is there a point at which the population health impact has really been reduced to negligible levels? And doing sort of general analyses, we say, no, we don't think that that's the case. We still think there's this large residual health effect. But this slide characterizes some of our most recent results that really indicate that what is happening is that air pollution has significant health effects as far down as we can look. One of the advantages of Canada having low air pollution is that we can study the effects of low air pollution, which is not so easy even in the United States, hard in Europe, very difficult in the rest of the world, which have much higher levels. But it's instructive for everyone to understand what's going on. We also have some of the largest health databases that can be analyzed. Medicare has provided a wealth of information, but there's these enormous, what we call administrative databases that have evolved out of Medicare. So essentially, anyone in every province has a healthcare card that every time they interact with the healthcare system, it's recorded. And we've been using those lately to analyze the effects of air pollution. So these are extremely large cohorts of people and their interactions with the healthcare system, and we're able to connect those and all those interactions with air pollution. And what we're finding is even down to the lowest levels the Canadian experience, which is pretty close to natural levels, we're seeing substantial health effects: mortality, advanced date of death, hospital admission increases, and a host of other effects. So, in all essence, from a pure view of when will the health effects of air pollution be low enough, well, we're unlikely to get there in the near term, and possibly not in any term. So we still have a need to continue to look at this, to continue to look at it in a societal benefit point of view. You can't spend an infinite amount of money to reduce these things. So you're always looking at what's the tension between costs to implement and benefits to the Canadian population. Right now, we still see very large benefits compared to costs for any measure being taken.
Well, it's excellent that you've mentioned a lot about the science and the scientific evidence that you guys are using to sort of facilitate some of that process with the air quality management and also the policies that are being implemented. But here in Canada, how is that scientific evidence being evaluated in the development of certain air quality policies?
Well, first and foremost, we do what I think a lot of countries and organizations do, is we look at the entire literature that's available. We focus more on the literature that's derived from countries like Canada, relatively low air pollution. So we tend to look at Canadian studies, which are now some of the best in the world, and also quite a lot of them, American studies, European studies. We do look at the rest of the world as well for clues about specific aspects of it, but we tend to focus on things that are extremely relevant to our own state of environment. So we do that review. It's an incredibly large job. I think everyone takes their cues from the US EPA, who do the best job of any group in the world. But so we follow along a little there, and we use what they do to help us. But my group spends virtually all of its time trying to keep up on the burgeoning literature associated with air pollution health effects. The second set of things we do is we evaluate policies. So if air pollution does say we should be reducing and we should be looking for, in the federal realm, we're looking for the most cost-effective ways of reducing air pollution. So we're trying to identify the most important sources, the ones that not only emit a lot but also expose the most people. Very remote sources of air pollution won't have huge population health impacts. They may have pretty significant environmental effects, but from Health Canada's point of view, it's about population health impacts. So we evaluate how the sources of air pollution interact with the people of Canada and look for the most effective ways of reducing that. That what we see is a fairly large residual impact of current air pollution.
Well, it's interesting you bring up the public health portion of it. So I'll ask the obvious, give you a chance to get on your high horse type question. So if the health benefits of a certain policy can't be demonstrated in some way from the public health perspective, does it mean that it wasn't worth implementing? No, as a matter of fact, it's not. And in fact, it is, as we've seen in some of the presentations this morning, it can be very difficult to directly demonstrate the benefits of a policy. We do have an enormous amount of emissions in atmospheric and health science to connect reduced emissions of air pollution pretty closely to improved health in the Canadian population. It's true in the US does a very similar job. Europe as well, WHO. We all sort of take a very similar approach in saying that we understand the health effects of air pollution. They're widely based. They seem to be unrelated specifically to particular sources. It seems to be all sources of air pollution have at least some effect and very similar effects, so that we're pretty confident that the benefits we predict of putting a policy in place are going to be realized. And there have been some studies in around the world and in Canada as well that try to look at these what were the benefits of taking a particular policy action. They're difficult to do. But nonetheless, they do demonstrate that there are, you do get improved air quality from reduced emissions, no big surprise, but that you do get improvements in health associated with those improvements in air quality. So I think we've been able to argue and create a scientific chain of events that tell us that taking the actions on the sources leads to benefits. As a Canadian, that's fantastic news. But that's all the time that we have right now. So I want to take this time to thank Mr. Barry Jessiman from Health Canada for joining me on this. So thank you.
You're very welcome. Thanks very much.